minutes. We're going to look at reading part A, and this is with regard to the topic hydration in the elderly. So it's not all about just hydration. This is very specific to the medical condition which affects the elderly. Remember that your part A, you will only have 15 minutes to write your answers or find your answers to 20 questions. So this is precisely one of the reasons why, even though part A questions are nice and easy, you find it hard, okay? It's because there is a timing issue. So you're going to have to read 4 short workplace texts, and you're going to answer 20 questions within your 15 minutes. Now, for those that have done the reading classes before, you understand that we put quite a lot of priority with regard to part A. The reason being is that in your reading test, you're going to have to answer 42 questions. And out of that, your target is a minimum of 30. Now, because you're looking for 30, your priority will be the questions that actually has quite a lot being asked in there. And that one is your part A. So part A, out of the 30 correct answers that you need, part A has 20 questions. So this gets you very, very close to that target score that you require. Part B, there are only 6 questions, which means it will take you a long time, even if you perfect the 6 questions in here. So even if you got 6 out of 6, if this is low and this is low, we're still going to have issues because it is very far away from your 30. So apart from your part A, the other one that has quite a lot of questions is your part C. So there's 16 questions in there, or only 4 questions lower than part A. So this becomes our priority. This is our second priority, and this becomes our third priority in terms of number. Now, the other reason why part A is quite important is because in terms of the question itself, they're very easy. Okay, all you have to do is find the answer as quickly as you can within 15 minutes. Okay, part B, although there's only 6, it's medium challenge. And then part C is not just 16 questions, but also quite hard. So this becomes our second priority still, and the part B becomes our last priority. We still look at part A as the most important, okay? So we try as much as possible to gain correct questions of about 16 points, okay? Our target really when we're practicing is 18, so we try as much as possible to push a little bit more. When we give you homework or you're doing your practices or your activities, aim for 4 in part B and aim for 10 points in part C. Anything that you missed in here, basically you need to add in here. So if you're not doing very well in your part C, make sure your part A is quite strong. If your part A is quite strong, then make sure that your part C is at least 50%. So you got 16 questions, aim for 8, okay? But it's all about having this as, leveled with your part Cs. Always make sure if you're strong in part A, this one is still slightly strong, 50%. If you're not so strong on your A, make sure these 2 are doing very well, okay? I had a student once, she was studying or taking the nursing exam. She called me after the exam in OET. She was crying and I said, what's the problem? She said she didn't finish part A. She panicked, okay? So I asked her how many questions she missed. And she said she only answered up to question number 15. So she missed 5, okay? But when I asked her how her part B and part C is, she said she was quite confident. She finished all of them. There was no problem. And then I said, okay, how about your part A? I know you didn't finish. how is your confidence with regard to your answer? She said she was quite confident as well. So I said to her, yes, it's a little bit worrying that you didn't finish 5 questions, but if you're telling me you're quite confident you found the right answers in part A, so that means that she's got the possibility of 15 points. Then that means she only needs 15 from these other 2. So if she's also confident in here, she might get 8, okay? 8 points, for that one. Even if she gets 6 in here, is still only 8 plus 6, that's 14, plus the 15, she's missing 1 point, so she needs a little bit more in here. But the good news is that she did pass. That means that her B and C were quite strong. So you always make sure that you pair these 3 together. Either you find A hard, make sure your B and C are strong. If you're quite good in A, make sure this is even moderate will be fine, okay? So these 2 together. Now, the common problems encountered in part A is number 1, timing, okay? You really need to develop your good reading skills in order to read fast and find the answers as quickly as you can. The second one is to make sure that you understand the question. When you are able to develop your keywords, you're able to develop a good understanding of the question, things that you shouldn't include, things that you should include, the grammar clues, etc., your answering strategies will become better. And when they're better, you will be quicker. So once you fix your problem into number 2, this also fixes number 1, okay? It's not you fix timing and you get this. No, this number 2 is the most important out of these 2 problems. Fix this, make sure you understand your question, make sure you've got your good question answering strategies. Once you have that, your timing will immediately improve, okay? The timing follows number 2. So in order to do that, remember that we've got 3 question types in part A. You've got the matching questions first, which is very similar to this one. So this is all about making sure that you understand what this question is and in which text can you find it. So at the moment, we've got text A, which is all about meaning and definition. Text B, which is assessment and treatment. And then text C is another treatment, but it's treatment via morphine. And text D is another treatment, but this is treatment with plaster backslab. So we've got 3 texts that are all about treatment. So when you've got a treatment question in here, possibility is that you're going to be torn between these 3, okay? But when you understand the questions, as I've mentioned earlier, things becomes easier. In here, we are looking for treatment, okay? But what kind of treatment? Treatment for pain relief. There's only one in here that is pain relief, okay? And that is letter C, okay? When you look in here, you're looking for a procedure. A procedure is, again, a treatment. So we're going to look at B, C, and D again, okay? But this time around, the treatment is all about splinting, okay? And splinting is not a medication, okay? It's possible splinting is in here, but there's nothing very specific in there. When you look in here, it's very specific. And splinting is the same as plaster backslab. That tells you the correct answer here is letter D. For number 3, you're looking for what you need to record. When you say you need to record something, it means you're writing it down. You're taking notes, okay? When do you take notes? When you are assessing a patient. It means the patient is in consultation with you, okay? And you are asking them questions, and when they answer, you're writing it down in your notes. And that means then that the correct answer in here will be in our part B area, because in part B, we're doing assessment and not just treatment. So we've got the assessment part in there. That tells you this one will be in number 3. Okay, so the answer in here would be letter B. By the time you go into number 4, you'll notice that OET use the word the terms. When you say terms, it means meaning and definition, the words, okay? When you say terms, it means the words, the meaning and definition, okay? You've got another information in here. It says it describes the different types of fracture. So it's not just giving you the meaning and definition, it's also describing, it's telling you, giving you information all about the different types of fracture. That means it's gonna fall under letter A, okay? So there's your clue that this one is an A answer. By the time we go into number 5, it's all about administration, okay? When you administer something, it means it's a medication. And the only one that has medication is your letter C. So typically, the key in here is to make sure that your summaries, your text area, you've read them very well. You've understood what they are all about. You've summarized them well. When you do that, you will be able to answer your matching questions very, very quickly. And when you answer them as quickly as you can, then it means your timing is also improving. Now, when you move from your matching into the middle and the last part, that can only be either a short answer question or a sentence completion. Now, both short answer questions and sentence completion requires that you can identify keywords, okay? Now, your keywords can be one of 3 words. You need to look for a noun, you need to look for your adjective, and you need to look for your verb, okay? These 3 are the best keywords, which means you're looking for a noun, an adjective, and a verb. And then by that time, you are able to decipher what the question wants you to find. So in question number 8, our first keyword is to elevate, which means this is a verb. A verb is an action word. So what are you doing? You are elevating a patient's fractured leg. Now, leg is a noun. This is our keyword number 2, okay? The noun tells us very specifically what we are elevating. So it is the leg area. When you think about it earlier, letter A earlier is all about meaning and definition. We won't be doing any elevation in there. That's just knowledge, okay? While letter B is all about assessment and treatment. And you're like thinking, okay, we don't elevate a patient's leg when we're assessing, but when we treat them, we do elevate their legs. So most likely, this one would fall under text B, okay? So what you do with text B is you think it's here because we've got management, we've got assessment and management is the same as treatment. So you think it's going to be on text B, you go into text B. What you will do now is you're going to look for the word elevate and you're going to look for the word leg, okay? And once you've done that, you will see that we've got elevate the limb in here. There's your elevate, same word, okay? When you say limbed, that could be upper limb, the arms, lower limb, the legs, which means we now found the leg in here. When you look further to the words next to elevating the limb, we found a sling for the arm, and a pillow for the leg. And this is very specific to the leg, which means that our answer, the one that we used to elevate a patient's fractured leg, is a pillow, pillow, or pillows. The reason why you've got 3 possible answers in here, but only one found in your text, is because this one says a pillow, okay? That is singular, which means you can use it as a pillow, singular, and you can use it as pillow, singular as well. Then the question is, why is the word pillows or plural acceptable? The answer is because this is a short answer question. When OET asks these questions inside the short answer question, they are slightly nicer in terms of your grammar, okay? Which means a singular can be accepted even if the required question is a plural, okay? Because your grammar doesn't affect the question itself. Remember that this can only be acceptable under short answer questions only. I'm going to show you a similar one later on under sentence completion, and you will notice it's not acceptable, okay? So it's nicer inside short answer. You can be grammatically different from their answer as long as it is still the type of answer that they need, okay? But under sentence completion, this is not acceptable. So when you look at your question number 9 and question number 10, you do exactly the same. We look for the nouns, the verbs, and the adjectives, okay? Once you find them, you will know which text you need to go to. And then from there, you can search or scan for your answer. So we do matching first. Where do we find the dosage of morphine? That was text C earlier, remember? Okay. And then it says intramuscular route. It means a type of administration. We can be oral, topical, intramuscular, intravenous, etc. This one wants the dosage via intramuscular only. So when you look into the morphine text later on, you look for the intramuscular, and then you look for the dosage, which is the maximum. When you say maximum, OET is looking for the highest one. So if the dosage is, say, 10 milligrams to 20 milligrams, OET will not accept if you write both of them. This will be wrong, okay? So that one will be considered wrong. Why? Because OET only wants the maximum. That means the only answer that OET will accept is 20 milligrams only. Okay, this is the only acceptable answer because OET wants the maximum, and between 10 to 20, this is the highest one. If OET says minimum, then you will need 10 milligrams. If OET only said what is the dose of morphine per kilo, then your answer will be the 2 of them, 10 milligram to 20 milligram. Why? We've got no specifics in here. OET didn't ask for the minimum. It didn't ask for the maximum. So always remember, make sure you understand the question, because if the question doesn't have the description here, just looking for the dose, then it means you need this too. If OET has a specific dose that they want, maximum only, that means they only want 20 milligrams. Okay? Any question? Any question? No? Type on chat just in case you've got any question. For number 10, that we have a grammar clue. The grammar clue is the word parts of a limb, okay? It means it's a body part that needs extra padding. Okay, so if the words you found was cotton stockinette, that is a pudding. It's not a part of a limb, which means we're looking for a body part in here. So the answer to number 10 could be legs, arms, upper thigh, lower thigh, lower arm, upper arm, finger, palm. These are the parts of our limbs, okay? But if it's not a body part, this should not be the answer to your number 10, okay? Maybe you see the word cotton stockinette, okay? I'll write it down. You will know, based on your question, if you understood it very well, that this answer is wrong because a cotton stockinette is the name of the padding. We're not after the padding. We are looking for the body part, okay? So always remember, between your two problems, timing and understanding question, your priority is to understand the question first. When you understand the question very well, your timing will improve, okay? So it's all about this, making sure you understand that. So let's have a look at the slightly harder sentence completion question. The strategy is exactly the same. We look at our keywords, noun, verbs, and adjectives. We've got the noun elbow, the noun hand, okay, the adjective outstretched, and the verb falling, okay? So verb, adjective, noun, and noun. Once you've identified them, what you will do is exactly the same as what we've done earlier in short answer. We're going to do matching first. We're going to think, where, in which text am I checking an outstretched hand of the elbow, okay? But this one also said we're looking for the cause. So when you're looking for the cause, you're not really directly asking the question to the patient. It probably meant you're doing some research with regard to a fracture, the cause of a fracture. And typically the reasons a fracture can happen is given in a meaning and definition, which means this could tell you you should be looking at text A for question number 15. When we look at question number 16, there are further grammar clues. The words before your blank space is an article, okay? So we get three types of article. We've got the a, we've got the an, and we've got the okay? When your article is an a, it's singular, okay? If it's an an, it is singular as well. Your the could be singular or plural, okay? It can be paired with plural. The other thing is that if this is an a, okay, your answer will start with a consonant sound. If the answer is an an or has an an in the front, this answer will require a vowel sound, okay? So which means if this is an a, we're looking for any answers that doesn't start with a vowel sound. Your vowel sounds are your a, e, I, o, u. Okay, your a, e, I, o, u. But it's the sound we're after, okay? So if I say cat, okay, a cat, okay, so this is consonant, okay? If I say an apple, okay, so this is your vowel, okay? So a, vowel, ka, consonant for that one, okay? So there is your clue. This is the normal one, but sometimes, as I've mentioned, it's all about the sound, okay? So if I say X-ray, do you think it's a or an? X-ray. Type on chat. A or an X-ray. Type on chat. What do you put in the front? Is it an A or an an? Yes, that's correct. Okay, so this is an X-ray. Okay, how come it is an an? Because the pronunciation is X-ray. Starts with E. Okay, it's the same with this one. Why? Because it is again very similar. You pronounce it as MRI. MRI starts with an E. Okay, this one. Okay, so that's an an. Okay, umbrella in there. Okay, these are your wordings that comes from your and your an. It's all about the sound. Okay, so this tells you this one, if your answer, the sound starts with A-E-I-O-U, your answer is wrong because these are vowels. Okay, so OET is already giving you a clue. The answer starts with a consonant sound. Okay, this one is also singular. Why? Because it's an A. Remember, an A or an is a singular. So if you answered S in here, that is correct. If you put an S at the end, plural, test, that is now wrong. Why? Because that tells you we require singular, and this one is plural. So you will notice that once your question is now or has now moved on to sentence completion, you've got to be very, very careful because your grammar will now be checked. It's no longer all about the answer, but the grammar needs to be correct as well. So grammar, singular, consonant sound. Okay, we're looking for, again, an upper limb fracture that should be elevated by means of a blank. So we need to elevate the upper limb. What are we going to use? Okay, so this is the one that we will write in there. Again, it is very similar to our question earlier with regard to elevating the limb. So we know that we should be looking at text B. Okay, now when you look at text B, you now need to look for any information about upper limb. And then when you look at the upper limb, we're going to look for the clue that it needs to be elevated. Okay, and then again, as I've mentioned, this is where the elevation earlier come in. Okay, we also read this part. And because we are looking for the upper limb, we are now looking at the arm area. So if it is the arm, the answer is a sling. But if you answered a sling in here, your answer will be wrong. Why? Because the word a or the article a is already there, which means OET will not accept your answer. So always remember, if the word is already written in your question, do not include it. So the only answer OET wants in here is just the word sling. So in sentence completion, if you answered a sling, in short answer, if you answered a sling or sling only, both of them will be acceptable. Even the plural form, slings, just like our answer earlier, a pillow, pillow, or pillows. All of them acceptable because they were under the short answer question. But in sentence completion, it's not acceptable. Why? Because under sentence completion, it needs to be grammatically correct. And because the article a is already there, you are not allowed to repeat it. So the only answer required in here is sling. Okay, any question? Any question? So you do exactly the same for 17. You look for your nouns, your verbs, and your adjectives. Any question? No? Okay, so hopefully you remember my big tips. Okay, it's all about understanding the question. What is the question asking you to find? Once you understand the question properly, you will become better at your strategies. You will become faster in looking for the right answer. Okay, strategies includes knowing all of these clues that OET are leaving behind for you. Limb means body part. A means it's an article that requires singular and consonant sound. Okay, so once you understand these clues, answering the question becomes better. Okay, so these are the very first strategies that you need to know. The next one is to ensure that you're able to summarize your text. So in order to summarize your text, because you're only given 3 minutes typically when you're summarizing, and I really do hope that all of you will summarize, because without summarizing the text, you will find it hard to understand them, okay? So in order to summarize the text, we will use what we know in real life. When we treat a patient, there is a procedure. Number one, you have to study first, okay? So it means you cannot be given a patient unless you've actually finished studying nursing, okay? When you study nursing, your study doesn't end because you need to understand the medical condition of the patient that you're talking to. Maybe you've graduated with your nursing degree, but you're not very familiar with the information with regard to asthma, okay? And you already know that tomorrow there will be an asthmatic patient who's coming in to see you. Someone has made an appointment, which means that they will be asking a lot of questions with regard to their asthma condition. So what you need to do is to ensure that you are prepared. And how do you prepare? You study, you research about asthma. When you research, that's when we gain the knowledge. That's where the meaning and definition would come in. That's when you will know how many types of asthma there are. That's where you will know what are asthma in children, what's the difference of asthma in adults, what are the medications typically given to asthma, what are the different testing and investigation for asthma. So you study first, you gain the knowledge. Once you know that, you will now have the confidence to talk to your patient. So you will be interviewing them. You will be doing a consultation, okay? So they will consult with you. What kind of information do you ask during interview or during consultation? Type on chat. What kind of questions do you ask? What kind of information do you need to know when we are on interview or consultation? What's happening there? No? Okay. You're going to ask them about their symptoms. When you ask them about their symptoms, typically you ask about onset and you ask about trigger. Okay? What are your symptoms? When did it start? Onset? How long has it been? And what do you think caused it? Okay? What are the triggers? So what is your symptom? When did it start? How long has it been? What are the triggers? Okay. Apart from that one, you also ask about family history and patient medical history. Is this condition? Is there anybody in the family that also has asthma? How long, have you had asthma for a very long time? Have you been hospitalized before because of asthma, etc.? So you're asking for the patient's history and the family history as well. Okay. What else happens during interview and consultation? You examine the patient. Okay. Examination, that's part of your assessment. So you assess the patient. Okay. So these are the typical things that happen during your interview or your consultation. What comes next is that you then make a provisional diagnosis based on what the patient told you, based on the patient's history, and based on your own examination. You're going to come up with a provisional diagnosis. This is the time that you might decide, I need to refer them, okay, to another professional. I may need to refer them for, confirmation of my diagnosis. Or this is the time that basically you're looking at your study again and thinking about the different types in here. So you're making some decisions now. After that one, in order to find out whether your diagnosis is right or wrong, you then proceed with testing and investigation. This is when you will have the words MRI, X-ray, CT scan, PET scan, blood test, urine test, etc. Now, these types of testing, they're pretty common in Reading Part A. You will see quite a lot of them. So your ability to medical ability to identify different types of testing and investigation would be quite good. Once you have the result of the testing and investigation, in real life, you start treatment because you already know whether you're right or you're wrong, okay? If you're right, you begin treatment. If you are wrong, you may do more testing and investigation, or you may refer them to someone else, okay? But we move into treatment. And when you are treating, okay, what you do in there is that you provide many different things. The number one is medication, okay? So when we treat patients, we typically give medication. We do a procedure just like the plaster back flap that I mentioned earlier, or we go for surgery, okay? So treatment could be treatment with medication, a procedure, or surgery. These are all part of your treatment. After you treat the patient, what happens is that hopefully everything is fine. You will discharge them, etc. Okay, that all falls under aftercare. This is the time that you discharge the patient. You ask them to come back for follow-up check. If they've had a surgery before, maybe this is when you're going to remove staples. Maybe this is when you'll ask them to come back for further change of dressings, maybe infection monitoring, or just very simply just assessing whether the patient's been compliant to any of your advice and recommendation. So these are the typical real life scenarios. Now, why is it important for you to know? Because your text A, B, C, and D are typically any of these 6. Majority of the times, they are very, very chronological, which means if you're giving meaning and definition in here, your consultation would probably fall under part B. This could also be a B area. You might, on text C, you might find testing and investigation. And then on text C as well, maybe treatment, and then maybe in text D, it might be aftercare. So they will be chronological. But that doesn't mean they all come all of these come in every text. Sometimes you might have this as A together with this as A, and this one would also be an A. Okay, well, this one is a B, this one is a C, and it's also a D. Okay, they could fall into any of these areas, but this 6 always comes up as your text A, B, C, and D summary. So always remember this 6 when you are summarizing. So we're going to practice this summarization that I keep mentioning. So I want you to always remember this 6. Think about them when you are looking at the text and trying to summarize, because when you summarize text like this, you typically will only have 30 to 45 seconds. You don't have a long time. You really need to understand how to read the text and how to summarize as quickly as you can. The very first thing that you need to find out is, do I have a title? Okay, because when you have a title, you already have a summary. This is all about the risk factors of dehydration in the elderly. So if you've got questions about kids or dehydration in children, you will not find it in text A. Why? It's very specific to the elderly. It's very specific to their risk factors. So if you look at your text A, it's all about the risk factors, risk vulnerable, okay, due to physiological changes. Okay, so there's our one risk in there. Okay, so the physiological changes in the aging process. When you go into the next one, it's age-related changes, reduced sensation. We've got renal function in there. Medication can affect it as well. And then in here is poor oral intake of fluids. So on the exam, because you've already got a summary, all you have to do is make sure you understand each of your paragraph. So physiological for that one. This one is age-related, something about thirst, okay? In here, it's all about reduced renal function. In here, it's all about medications. And then in here, it's inability to feed. So all you do in the exam, you've already got a summary, is underline the words that will tell you what each of the risk factors are, especially because you've got a paragraph in here, okay? So your job is to identify them. So we know it's all about the risk factors in the elderly. What is it because of the physiological? We've got Alzheimer's disease in there. We've got renal function, exacerbation due to medication, inability to feed. So make sure you analyze, see where they are very, very quickly. We don't read, we just go through very quickly because we already know what these are all about, risk factors. The next thing you think about is, what could be the synonym of it? When you say risk factors, it's the reasons why, okay? The reasons why they are at risk. So you're thinking to yourself, okay, risk factors. It gives me all the different reasons why an elderly could be high risk for this one. So reasons why is your synonym in there. Okay, I'm gonna ask you now to have a look. I'm gonna give you 45 seconds. We've already got a title in there. It's all about hydration assessment. Assessment, it means you are interviewing, you are consulting with the patient. Have a look. Where is the interview? Where is the consultation? What is happening in this text? 45 seconds. Okay, hopefully everyone was able to identify the, the important clues in here. So we've got the title in there, which is your hydration assessment. And then you'll notice that the first one are all the information that you would need to ask the patient. So it says conduct an assessment including. So these are the things you will ask the patient to tell you: their medical history, their current medication, cognitive status, continence, etc. So these are the questions to the patients. Well, this one are your physical examination. We don't need to look at any of them anymore. We know that this text is split into two. The first one is asking for their symptoms. So this is the interview. The second part is your own physical or the physical examination of the patient. So the text is all about how to assess and how to examine patients. That includes their history, their signs, and their symptoms. Okay, another 45 seconds. Think about part C or text C. What is text C all about? Okay, so for this one, again, we already have a title. So we look at the title, Recommended Fluid Intake, okay, for adults in residential care. And that fluid is in liters per day, not per hour, not per week, not per month, etc. It's very specific to per day, which means that when OET asks you how many liters, you might have to write 1.5 liters per day, okay? Because just simply answering 1.5 is different from 1.5 liters per day, because it could be just 1.5 liters, and that's different too per day, okay? So always make sure you understand the specifics. So in here, there are two considerations when you are giving fluid to your patients. It's with regard to their height and it's with regard to their weight, okay? So if the height is 150 centimeters and their weight is about 40 kilograms, you're gonna give 1.5 liters per day, okay? So all about understanding. So this is all about your recommended fluid intake in liters based on height and weight, and it is per day for this one. We have a look. Yes, okay, very good, Yvonne. Yeah, fluid, very good, Lynn. It's all about the fluid intake, yeah? But two considerations, always remember there are two things to consider there. Next one is your text D, 45 seconds again. Understand, there are three areas in here. Remember, this is one area, second area, third area. You need to identify what's the similarity and differences? What are they talking about in per section or per area? 45 seconds. Okay, remember this is split into 3 parts. It's all about how to manage the hydration in a residential care context. You will notice it's split into 3. This is all about the knowledge of the staff and their education. This is assessment of a resident, okay, if they're dehydrated. And this is the assessment of the resident when they are not dehydrated. The symptoms are relieved, okay? So you can see educating the staff first, patients that are dehydrated, patients that are not dehydrated, okay? What do you monitor for? Because it might be overhydration in here. So 3 different areas, how to manage hydration, the requirement for the staff, what to do, and how to monitor, but depending on whether they are dehydrated or not dehydrated, okay? So let's test it out now that we've had a look on this A, B, C, and D. Hopefully you remember what they all are, okay? And let's go and find out, okay, how to do your matching. So answer questions 1 to 7. If you remember what they are all about. If you want, I can write it in here. This is risk factors. This is sex and examine. This is fluid intake. Okay. And the last one is management. One to 7. Give it a try. Last 30 seconds. Okay, let's give it a try. Let me just remove the rest of my summary. So we've got the text factors and the reasons why. How do you assess and to manage patient history, signs and symptoms? The recommended fluid intake in liters based on height and weight, and how do you manage hydration? What the staff requires, what do you need to do when they're dehydrated? What do you need to do when they're overhydrated? How do you monitor? Okay, so for the first one, we're looking for how we're going to determine. There's your verb, how to. Anytime you see a to in there, this one is a verb, to determine, to act, etc. Okay, patient is your noun. Okay, suffering is your adjective, and then another noun, dehydration, in there. So determining means what? Assessing. Okay, when you're trying to determine, you're trying to decide whether they are dehydrated or not. That is assessment. Okay, for number 2, we're looking for the amount to be to drink over 24-hour period. 24 hours is a day. Amount is your liters. Okay, that means the answer here is letter C. So remember, 24 hours is per day, which was in here. Amount is liters. For number 3, we're looking for the information that we need to obtain. When you say obtain, to get, okay? When an individual enters residential care, how do you get their information? By interviewing them. It's all about assessment and examination. That's the only time you can obtain or get their information. Next one, how do you deal with dehydration? When you say deal, you're acting on it, you're treating it, you're managing it, okay? Remember, treatment and management, they're synonymous to each other. So when you manage somebody, you're treating somebody, it means you are dealing with them, you're working with them, okay? That means the answer here is letter D. Next one, the correlation between body size and fluid intake. When you say correlation, it means the link, okay? The link between the size of the body and the fluid that they need to take. This body size is the weight, okay? And the height, okay? So the height and the weight of the person is your body size, and the fluid intake is your liters again. So this is letter C. Next one, indications that your patient may have consumed too much liquid. Too much liquid is overhydration, okay? And remember, there is only one text that talks about overhydration. That is text letter D, okay? We didn't write it in here, but if you remembered earlier, we had 3 things. The staff requirements, the dehydrated patients, and the overhydrated patients, or the ones that, you know, the symptoms have been relieved. So this one is your text D. For your last one, we're looking for the different conditions that increases the likelihood of dehydration. When you say increase the likelihood, it means they are at risk. Their situation is worsening or exacerbating, getting worse, which means we're looking at risk factors in there. When you say risk factors, condition is getting worse, exacerbated, or worsening, etc. Okay, deterioration as well would be another synonym in there. So if you can summarize very well, you can understand what the text is all about, looking at your heading, looking at your subheadings, looking at your paragraphs, and you know whether is it just telling you meaning and definition, okay? Is it telling you that you're interviewing the patient, asking their signs and symptoms? Is it telling you they're talking about testing and investigation, or could it be treatment? If it's treatment, could it be medication, procedure, surgery, or is it aftercare? Is it things I do once the patient is all right and has been discharged, okay? So hopefully you got things very well, okay? Lynn shared it with me, very, very good score, Lynn. So hopefully a lot of you scored 5, 6, or 7. That's what you need in here, okay? So if you scored 5, 6, or 7 in part A under matching, it means your understanding is good, and it means your question 8 to 20 will be good as well, because your matching is the most important out of the 3 questions, because you do matching for question 1 even up to question 20, all throughout 1 to 20. You are always doing this, because you can never find the answer to 8 to 20 without matching first. The matching is the most important. And you will notice that your matching is all about the synonyms of the 6 that I mentioned earlier. The study part, the research, the education, the meaning and definition, moving into interview and consultation and what happens there, moving into diagnosis, moving to testing and investigation, moving to treatment, and finally doing your aftercare. They all fall within this 6. If you can analyze your text based on those 6, you will go very well. It will be very easy for you. And typically, I gave you 1 minute and 30 seconds in here, but typically within 1 minute, 1 minute 10, you should be able to find your answer for these 7 questions. Okay, so thank you very much, guys, for coming today. Hopefully we've given you some new strategies or some refresh strategies to help you answer the questions better and quicker, and to hopefully speed up your reading strategies, reading answering skills as well. Okay, thank you very much, everybody. Take care. Bye for now.